What do you need to know before you go for a joint replacement? Did you know that joint replacements cause irreversible damage to your body? In this video, you can learn the risks and potentially fatal consequences of joint replacement surgery. And also you will be able to discover the alternatives. Today, every third adult American has a problem with one or more joints. It becomes an epidemic. Have you ever thought of why it happens? The most common recommendation by medical doctors is joint replacement. Joint replacement is actually only removing a symptom, but it is not going to solve your problem. You have to understand why joints start to degenerate and how to prevent it, stop it, and even reverse the whole process. Maybe you were scheduled for joint replacement and you are scared to do it. Maybe you are worried about looking old and wrinkled. Well, we can help you with preventing or even reversing this process. Maybe you were told that pain, medications, surgery are a normal part of the aging process. Actually, what is normal is being healthy and discomfort-free. My name is Dr. Grażyna Padziunen. I have a PhD in electrical engineering and I was invited to the United States to teach at a university. I was involved in biomedical and other research for over 25 years. My son Tony is a certified health coach. We are a mother and son team, and we have been helping people for almost 8 years now with their mobility and nutrition. We have developed a 3-step mobility formula that is proven to be very successful in dealing with joint discomfort and chronic pain. We will share with you a secret. We will teach you how to stay flexible, healthy, and discomfort-free and have a beautiful skin without medications, surgery, expensive creams, just with natural supplements. But first, let's think about what exactly happens when we age. You may ask yourself, how can we slow down or maybe even reverse the joint degeneration process? Is it even possible? The answer is yes. So how can we do it? This is our secret that we will reveal to you. It is clinically proven and it works. It is possible to argue with science, but it is very difficult to argue with the results. Joint replacement reliably reduces joint pain. They, however, fail to correct disability. There are dramatic declines in lower extremity neuromuscular function during the early post-surgical period. These deficits are never fully remediated. They remain for years after the surgery, and they contribute to persistent disability. Aside from the risks for any joint replacement surgery, which include blood clots, anemia, infection, and pneumonia, even successful joint replacements typically only last between 10 to 20 years. Redoing or revising a joint replacement after the original replacement has worn out does not have an as high rate of success as first-time joint replacements, and revisions usually take more time in the operating room and require more rehabilitation time. Just like first-time total joint replacement surgeries, revisions have become more common. Redo revision surgery is much more difficult. Revision surgery is more complicated. It takes longer than first-time total joint replacement, and the outcomes are usually not as good. Revision surgery is also costly, and it requires highly experienced surgeons and support staff. Before a new implant can be put in place, the surgeon has to take out the original implant and sometimes bone and tissue nearby. The bones may be weaker than when the first surgery was done, so the surgeon may need to reinforce them with bone grafts or bone particles from your body or from a bone bank, metal plates or wedges, rods, and/or wire. Once the surgery is done, the hospital stay afterward may be longer than for the first-time replacement, and the overall recovery time is also longer. There are also some other possible complications. After knee replacement revision, people may have a problem with the alignment of the leg, shortening of the operating on leg, and reduced range of motion. After hip revision, one leg may be shorter than the other, and people may need to walk with assistive devices such as a walker, crutches, or canes for longer than with first-time joint replacement, depending on how much bone grafting was needed. Minimally invasive procedures, such as those used for first-time hip and knee replacements, aren't available for revision surgery, since the surgeon needs to remove the original implant. Let's listen to one patient's joint replacement experience. 2 years after she had both hips replaced, Judy got some bad news from her doctor's office. The all-metal artificial hip used in her operations has been recalled. The metal ball and metal socket were rubbing together, and slivers of metal that were rubbing off were going into my bloodstream, she remembers being told at the time. Judy Commonwealth, now 68, would need a blood test every 3 months to determine the level of metal accumulating in her body. 2 years after the recall, the levels were deemed high enough to warrant a second surgery or a revision, but her original surgeon wouldn't perform it himself. She was sent from her home in Hackettstown, New Jersey, where she runs her part-time cleaning service, to Philadelphia, where a specialist performed her left revision in 2012 and her right in 2013. The second time around, it was much harder to recover, she says. The surgeries have been more invasive, more extensive this time. She was in more pain. She had to rely on a walker for longer. She had lost some of the bone in her hips, and tumors had grown in its place. Blood tests after the revision surgeries showed the metal in her blood was retreating, but in 2015, about 5 years after the recall, she is still not entirely back to normal, she says. Listen to another patient's joint replacement experience. He says, I had a partial knee replacement in 2014 and ended up having a total knee replacement in March 2015. Well, it's been a year and 4 months and my knee still gives me pain. I cannot sleep. It aches badly and there is pain that shoots down. Not only that, but it is swollen and it makes an awful noise, like it's loose. Even a successful joint replacement will remove just the symptom or discomfort, but it will not solve the critical problem of why the joints start to degenerate. Soon other problems will start to show up. Is there an alternative to this nightmare? The missing link to joint regeneration is the 3-step joint mobility formula. But let's first review what happens when we age. Our body breaks down faster than it is building up. Collagen and hyaluronic acid levels go down, so we are drying out no matter how much water we drink. We have more wrinkles. We lose flexibility. Our joints start to hurt and we develop a lot of chronic pain. We have difficulty to move. Hormone levels are changing. The immune system is less efficient. There is a lot of oxidative stress, a lot of free radicals. The digestive system slows down. Our memory is worse. We have less muscle mass. Inflammation occurs more frequently. We tend to shrink and our internal organs shrink. Click Learn More if you want to learn how to slow it down or even reverse it. You will also learn how to improve joint mobility and lubrication, how to drastically reduce chronic discomfort, and how to promote healthy cartilage and connective tissue throughout your body. You may be thinking, is our 3-step mobility formula for you? If you wake up stiff with a lot of discomfort and want to get up in the morning without discomfort, it is for you. If you feel like your cartilage is gone and want to rebuild it, it is for you. If you want to participate in your favorite sports again, it is for you. If you want to be discomfort-free and enjoy your life again, it is for you. Why is this important for you now? It is the first time in history you can improve joint mobility by addressing the cause of the problem instead of just removing symptoms. Because of the 3-step joint mobility formula, it has never been easier to promote healthy cartilage and connective tissue throughout the body. Your doctor might have told you it's not possible to rebuild your joints, but you will see that this is not true. Most of the things you've been told about dealing with joint discomfort are dead wrong. Let me give you some disclaimers and qualifications. First of all, this method is not about just removing symptoms. This method is not for people who want a quick fix. This method is only for people who are serious about their health and willing to adapt their lifestyle to feel and look great to the end of their lives. Clinical trials show that using this method, 90% of people have a 40% improvement in joint mobility in just 3 months. Consider the following example. My husband had a problem with his shoulder. He was not able to lift his right arm without the help of the left arm. He was in a constant discomfort. His shoulder was too damaged for surgery. The doctors gave him 2 choices, either a total reverse joint replacement or live with discomfort to the end of his life. The 3-step joint mobility formula provided for him an alternative solution. He did not believe it could work. And the first month it did not. He was losing hope. The second month's discomfort increased. Fortunately, in the 3rd month, it started to work. Today, he's doing 20+ chin-ups, push-ups, and water skiing on a professional level, and he feels like he has a brand new shoulder. You may be thinking there are so many products on the market, and everybody is telling you that their product is the best. Also, most collagen products simply do not work. There are many methods offered for joint problems that either only deal with removing symptoms or deal with just correcting one joint, but they do not address the real root of the problem. Well, the 3-step joint mobility formula is the only clinically proven system to improve joint mobility and reduce chronic discomfort in 3 to 6 months. I know living with discomfort is very frustrating. My husband could not sleep at night. One of my friends was not able to dress or even brush her teeth by herself. Another one could not hold a glass in her hand. Many of my friends had problems with playing their favorite sports like golf or tennis, and some of them could not even walk. They felt discouraged, frustrated, old, and worried about their future. They woke up with discomfort, and a lot of them were not able to perform simple everyday tasks. They lost hope for a better future. We knew there had to be a better way. We studied the joint mobility problem and found out why the most popular methods don't work. We dedicated ourselves to finding a solution that solves and prevents the problem instead of just covering up the symptoms. We made a commitment to help people transform their lives. We went all in. The breakthrough. My husband can now do 20+ chin-ups and push-ups, and he water skis on a professional level without any discomfort. My friend, who could not walk without massive discomfort, took a 6-kilometer walk for fun just 3 months after he started his program. Another friend, who was not able to hold a glass in her hand and had lost hope for a better life because nothing that she tried could help her, served us dinner in gratitude just 4 months after she started her program. Another lady who could not dress by herself is totally independent now. So just imagine how different will life be once you can wake up without discomfort. How wonderful would it be to play golf and tennis again and feel and look many years younger, and to be able to enjoy your life again. And just imagine, how will it feel once you've regained your mobility and once you've gotten rid of the chronic discomfort that's bothered you for years? Maybe you have some doubts if you can do it. Maybe you believe you can't change your lifestyle and it's too difficult to change your diet. Perhaps you think you have too much pain to exercise. Maybe you think you have no time or you are not disciplined enough. Maybe you tried different supplements and different methods, lost a lot of money, and nothing worked. Well, I just tell you, the 3-step joint mobility formula is the only clinically proven system to improve joint mobility and reduce chronic discomfort in 6 months or less. If you've ever struggled with joint mobility problems and chronic discomfort and tried many things without results, I know exactly how you feel. Because there are many products and methods on the market offered for helping with joint discomfort, but most of them don't work very well. They mainly deal with removing symptoms or with just fixing one joint, but they don't solve the original question of why joint degeneration started to occur in the first place. The 3 steps joint mobility formula shows you: number 1, the maximum mobility diet. That means how to choose foods that promote joint health for your unique body. Number 2, the joint mobility multiplier. That means how to exercise to achieve joint mobility and flexibility. And finally, the matrix nutritional system. That means how to choose optimal supplementation for the fastest results for you. The supplements that we are recommending receive 7 US and international patents and numerous industry awards. And remember, it is not what you give the body, but what the body absorbs what's important. When you give the body what it needs, it can heal itself. Just click Learn More for more information or to contact us. Maybe you were scheduled for joint replacement and you are scared to do it. Maybe you're worried about looking old and wrinkled. Well, we can help you with preventing and even reversing this process. Maybe you were told that pain, medications, and surgery are a natural part of the aging process. What is natural is being healthy and discomfort-free. We will be happy to share with you our secret and to help you to feel great again. Remember that health is wealth. When you give your body what it needs, it can heal itself. Just click Learn More and let's get started.